Thank you for joining me. I'm going to talk a little bit about breath and pelvic floor. The reason why we're talking about this is because I often see people making referrals out because they have somebody that comes in with some pelvic floor symptoms and they just don't know how to handle it. And absolutely, a pelvic floor physio is gold. I have been to a pelvic floor physio who's changed my life, gave me some really great strategies to use. But not everybody is open to seeing a pelvic floor physio. Not everybody has the time or money to maybe see another practitioner, or maybe they feel very comfortable with you, or maybe they have just some minor pelvic floor symptoms that can be corrected with some simple interventions. So I'm going to give you a simple intervention for some pelvic floor symptoms and a lifestyle intervention also. You can find me if you need to contact me about any questions. You can find me on social media at sensorimotor_retraining or on Facebook as Lori DiGiulio Movement and Manual Therapy, and certainly contact me through all other ways to contact me through a website or email address if you like. So let's start looking at this content. So this is the intrinsic core. What you're seeing here is you're seeing some of the components that make up the intrinsic core. So the intrinsic core is made up of the thoracic diaphragm, which you see here underneath the rib cage, separating the thoracic cavity from the abdominal cavity. And then you see this muscle here on the right side of the diagram that you can see has kind of horizontal fibers, and that is transversus abdominis, or one half of transversus abdominis. And then on the left side here at the bowl of the pelvis, you can get a little bit of a view of the pelvic floor. What you can't see in this diagram are multifidi. So multifidi are these muscles on the back, and they are found between adjacent vertebrae. They control intersegmental movement of the vertebral segments. And these are the structures that make up the intrinsic core. They actually create this canister in the trunk that, when pressurized, gives us this stability and power, or stability and foundation in the trunk to distribute power outwards into the periphery, into the limbs, to give us power in our legs and our arms. And so these structures are really important. And when one of them is not functioning really well, all of them really aren't functioning well. And so what we're going to look at is how breath can improve function of all these structures, including the pelvic floor. So let's look at this structure here. This is the thoracic diaphragm, or the diaphragm, often just called the diaphragm. So what you're looking at is the underside of the thoracic diaphragm. So if you were the bladder and all the other organs were removed and you looked up, this is what you would see. So what you see here is the thoracic diaphragm and some of its features. So what you can see here is a few holes in the diaphragm. One large one for the inferior vena cava that takes blood from the abdomen, lower limb back to the heart. A central hole for the esophagus to take food into the stomach. And then a hole at the back, and the blood vessel that runs through it is shown here. A hole for the aorta, which takes blood from the heart to the abdominal cavity and into the lower limbs. And so this makes the thoracic diaphragm not only a muscle of respiration, but also an influencer of the circulatory system and digestion. And so this is a really important structure. And when the thoracic diaphragm contracts, it goes from more of a dome to flat. And that causes the lower ribs to move out to the side and causes the organs to be pushed down. And what the organs will do is they'll be pushed down and forward so that the belly kind of puffs. They'll get pushed down and back into the vertebral segments, which causes a little flexion of the spine and puffing in the low back. And then they'll also get pushed down into the pelvic floor. And that's the key. That's how breath ensures pelvic floor health. So this is the pelvic floor. This pelvic floor looks a lot like the thoracic diaphragm in its construct, right? It's more of a circular kind of shaped muscle. It is also domed, but its dome is going downwards rather than upwards. And so when you inhale and the organs get displaced down into this pelvic floor, the pelvic floor musculature needs to receive the organs. And so it eccentrically loads, or it lengthens as it loads. And then on the exhale, it shortens and loads, contracting and pushing up to facilitate the exhale and also to support the genitourinary organs. And so in this way, every time you inhale, You get to stimulate the pelvic floor. Every time you exhale, the pelvic floor gets to contract and earn strength. This is really the way that we ensure that the pelvic floor is constantly stimulated in a healthy, natural way. And so we don't need to guess at whether or not the pelvic floor needs to be stronger or whether the pelvic floor needs to be more relaxed when we use a breathing drill. Because when we use a breathing drill, we are highlighting the natural function of the pelvic floor with breath. And so this is great for people who don't have the ability to touch the pelvic floor and don't have tools to test whether or not the pelvic floor is too tight or too weak, because this breathing drill can be used for anybody to highlight improved efficiency of the pelvic floor. So one of the things that these structures, like the thoracic diaphragm and the pelvic floor, is to face each other. And so when the thoracic diaphragm and the pelvic floor face each other, like you can see in these diagrams here, is that when the thoracic diaphragm contracts, it pushes the organs down, loading the pelvic floor evenly. But when you get a change in the orientation of the pelvis or the rib cage, then you don't get stimulus of the pelvic floor appropriately. And this is often what happens. People's postures lend to some of their pelvic floor dysfunction, specifically that kind of a larger arch in the low back, causing lots of downward forward pressure into the pelvic floor, creating more strain on the urinary bladder and potentially more symptoms of incontinence. And so when we do a breathing drill, we want to put these diaphragms, the thoracic diaphragm and the pelvic floor, in a position where they face each other so that we can maximize their stimulus to each other. The way that we can do that is we can either prop the heels up or we can put the feet on the ground and the knees bent to normalize the position of the pelvis. When we inhale, what should happen is the thoracic diaphragm should contract so that dome starts to flatten and the pelvic floor relaxes. I've put this in quotations because we know there's no such thing as relaxation, right? A muscle either loads and shortens or loads and lengthens. And so in the inhale, the pelvic floor is actually loading and lengthening parts of it. On the exhale, the thoracic diaphragm relaxes, or it eccentrically loads, or it goes back to neutral, and the pelvic floor contracts, or it concentrically loads and shortens to help support the genitourinary structures. This is a really important function of the pelvic floor, and when we talk about the lifestyle factor that we can change, that will also come into play here, utilizing that exhale to support the pelvic floor structures when we move. So let's do this breathing drill. I'm going to link you up to a video that I've done showing you this supine 90-90 breathing drill that you can go through that highlights all of these aspects of breath and how it's utilized to stimulate the muscles of the intrinsic core.
Hi, Lori DiGiulio, registered massage therapist and NKT practitioner. I'm going to show you a breathing drill that I often give my clients, especially those who have acute pain and aren't able to start to develop strength really well. Breathing is one of the first things that we learn how to do. It's the way that we earn motor control. It's the way that we earn core stability to allow us to then progress to stages including crawling and walking and more complex movements as we age. And it's a really important part of how we start to become aware of how to well use our intrinsic core, those structures that make up the deep core that supports our trunk and allows us to distribute force outward. And so this drill I'm going to show you is called supine 90-90 breathing. And so you're going to get into a position where you're on your back and your hips are at 90 degrees and your knees are at 90 degrees. I'm going to use a ball to support my heels, but you can use a chair or the edge of your couch. That's absolutely fine as well. So when you get into this position, you're going to do the 360 breathing drill. And if you've worked with me, then you know the 360 breathing drill. It's the drill that we start to look at when we're assessing if you can access deep core function. And so when you do a 360-degree breathing drill, when you inhale, your ribs move out to the sides, your lower ribs. Your abdomen domes from the base of your breastbone to the top of your pubic bone, and your low back puffs into the floor. And so this essentially brings your breath 360 degrees around the trunk. That's why we call it 360 breathing. And you're going to do it in a position where you're slightly supported. You can progress this drill so that you're not supported, but right now we're going to do it supported by a ball or a chair. So you're going to get into supine, which is on your back. Your heels are going to be supported by the ball. So you can see here, my hips are at 90, my knees are at 90, and my heels are supported by the ball. Not this. This is not a passive drill. I want you to have to control the position of your legs just slightly. And so your heels are the only part of your foot that is supported, and you're also not kind of just hanging out here, right? The knees are in line with the hips, the toes are facing the ceiling, and you're controlling, on a small degree, the position of your legs. And then you want to become aware of the position of your pelvis relative to the lower part of your rib cage. And so your thoracic diaphragm, here the muscle of breathing, and the pelvic floor, they like to face each other. And so they don't want your ribs tipped up or tipped in, because those two diaphragms want to face each other so that they can complement their movement. And so become aware of the position of that low back. You don't want the low back flat into the ground, and you don't want a big arch. You want these bottom ribs tucked gently into the abdomen without pressing the low back into the floor. So just place your hand under your low back and just make sure you can get your hand a little bit easily underneath that low back. Okay, so my diaphragms are facing each other. I'm going to make sure my neck is long and my chin is tucked, so I'm looking down at my chest. And then I'm going to take nice big inhales in through my nose. And when I take an inhale, I'm going to put my hands at my lower ribs. And I'm going to take an inhale, giving my ribs a little bit of pressure, a little bit of proprioceptive input, so that I can help push my ribs out into my hands. And I'm not doing this by active muscle contraction, except for the diaphragm. What's happening is I'm filling my lungs so much that the ribs move. So you're going to take an inhale, the ribs move lateral. Exhale also through the nose if you can. The next part of the breath is here in the abdomen. And so what you want to get is you want to get the lower ribs moving lateral, and then you want to get a nice dome from the base of the breastbone to the top of the pubic bone. Not a pooch, so you're not pushing your belly out. You shouldn't create an arch in the low back. It's not pushing your belly out. Again, you're filling your lungs so much that it distends the abdominal contents, all those organs, and they have to go somewhere, so they push out. So let's do that again. Take an inhale. Lower ribs move out to the side, belly domes. What you also should be aware of in 360 breathing is that it's also happening through the back. You've got really large musculature back there, so you're not going to feel as big as a puff as you do in the abdomen. But if you place your hands in the low back and you take an inhale, trying to inhale so much that the abdominal contents get distended forward, outward, and behind, you should feel that the low back puffs slightly. At the end of that inhale, you might also get this sensation of pressure in the pelvic floor, just really gentle pressure as the organs start to come downward and press gently into the pelvic floor. This is also a really great way to start to train the pelvic floor to become healthier in terms of how it supports the genitourinary organs. And so as you progress this drill, you can bring the feet off the ball and hold the feet up actively into this supine 90 position. That's definitely a little bit more challenging. You want to make sure that you're in a position that you can breathe well, not in a position that you perceive as more difficult. More is not better, better is better. And so that breathing drill is probably part of your homework if you've received this video. If not, and you're just kind of searching for ways to improve the function of the core, this is a great drill to begin to earn that strength again, earn that control again. And really great for people who are in acute pain, especially acute low back pain. You want to make sure that while you're doing that drill that you're not increasing pain. And so only inhale as much, only create as much distension as you can without creating pain. What you can do to amp up the activation of some of those deep core muscles is make a hiss or a tss sound at the end or at the exhale. And so you would take your sharp breath in, filling the lungs, 360 breathing, and then make this tss sound on the exhale. That tss sound, as you gently pull the belly button in, helps to activate those deep core muscles just with a little bit more force. And so that can be a way to progress this drill as well. If you're not sure whether or not that drill is appropriate for you, if you need a little bit more coaching, make sure you contact a professional that can guide you through 360 breathing and teach you how to get out of pain.
So when we did this breathing drill, we wanted the diaphragms to face each other. So we did this supine 90-90 breathing drill with the heels supported. You can absolutely do that with the feet on the ground and the knees bent, and in a variety of positions. So for you yoga people, legs up the wall is a great position to do this in as well. What you're looking at is making sure that you start with the pelvis in neutral and the TL junction, which is the junction between the thoracic and the lumbar spine, in neutral or having the ribs tucked. Often people have rib flare, and so keeping the ribs tucked into the belly so that the pelvic floor and the thoracic diaphragm face each other is ideal. And the way that you can get the sensation of having that rib tuck is having your patient or client cough. So a little helps to create that little rib tuck that you want them to maintain when they're doing this breathing drill. And then, of course, the neck is long and the chin is tucked to put everything in a neutral position. What you want to do is you want to teach people how to use this breathing drill so that they can stimulate all of those muscles in the intrinsic core, including the pelvic floor, but then work up to being able to do this in multiple positions. And the reason why this is important is because the breath should be able to stimulate the intrinsic core structures in all different positions. The pelvic floor needs to be able to support the genitourinary urinary structures in all positions, especially in those that exacerbate symptoms. So for me, I had a disc trauma and some pelvic floor symptoms, and one of the positions that really exacerbated my symptoms was when I had to jump or hop. And so if I went out for a hike and I had to jump over a couple rocks and I had to bring my legs apart, whether or not it was in the frontal plane or sagittal plane, so leg forward or leg out to the side, that separation of my legs in abduction or one inflection extension increased pelvic floor symptoms for me. And so I needed to work in a lunge position, for example, or if you're a yogi, in that pyramid pose kind of position with one foot in front, one foot in back, and doing my breathing drill in that position so that I had carryover into those lifestyle activities that really exacerbated my symptoms. So if you have somebody who leaks a little urine every time they get up off a chair, then that's how they should be practicing this breathing drill. Seated in a chair first, doing their breathing drill, and then practicing getting up from that chair using this next tool. And this next tool is referred to as BBYG, stands for blow before you go. And so this was, I believe, popularized by Julie Wiebe, the pelvic floor physio. Blow before you go is a little reminder that you should be exhaling on effort. So we know that with exercise, and often we do that. So we exhale on effort. We don't often do that in our daily tasks. So the suggestion that I often will make to my patients is blow before you go anytime you're doing anything. So when you get up off a chair, take an inhale, start the exhale, and then get up off the chair. People say that they're doing this, but they're often not. So I'll tell them to show me. They'll sit down in a chair, they'll get up, and once they've lifted their butt, I hear, That's not blow before you go. That's not exhale on effort. That's exhaling after effort. And what happens then is that when they exhale after they do the movement, they're causing huge amounts of load into the pelvic floor. And not as huge as if you were deadlifting 500 pounds, but cumulatively over a whole day, a whole week, a whole month, a whole year, all of that pressure down into the pelvic floor, eccentrically loading the pelvic floor, can create weakness and dysfunction in the pelvic floor. So I teach them that they take an inhale, and once they start the exhale, then they can move. And they do this for everything. When you get up off a chair, when you open a door, when you pick up something off the ground. And when you can do that, you get to earn strength almost every moment of the day. And so it becomes a little overwhelming if they're doing it for everything. But as much as possible, trying to pick a few movements maybe in a week. Like every time I open the door, I'm going to really consciously exhale before I open the door. Initiate my exhale first. For the next week, I'm going to focus on really every single time I get up, making sure I exhale before I get up. Supine 90-90 breathing drill, or breathing drills in multiple positions, plus blow before you go, are really, really two important interventions that I found work really well for my patients with pelvic floor health concerns without having to go to a pelvic floor physio, or if they don't want to go to pelvic floor physio, a couple of these changes can often net them some really great results. If you have any questions about those drills, if you have questions about whether or not they're appropriate, please contact me. I'm available through social media or through email.